Joining us now, Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention, the CDC. Doctor, good morning to you.
Good morning. Thanks for having me.
It's nice to be with you. The White House, as you well know, announced these guidelines on how individual states and communities can return to normal. Just to state the obvious, this is extremely tricky. It has to be done correctly. I was interested to see a Pew poll that said 66% of Americans are worried their leaders will relax restrictions too quickly. Before we get into the details, big picture, how worried are you about that? How worried are you that this may be done too quickly and risk another outbreak?
Well, Savannah, I think that's why we put out the guidance, to give recommendations of what really the important gating criteria is for individuals to consider. Clearly, really important that the outbreak in these jurisdictions is really declining consistently over a 2 weeks period. We have very good surveillance systems in this country that look at flu-like illness and syndromic surveillance for illnesses like respiratory disease, and we're seeing all of those drop substantially. So there are a number of jurisdictions really that have limited activity, but the critical thing is to let the states look at it, their public health systems, and give them a list of some of the key preparedness activities they need to have, like the ability to do rapid testing for new case identification and contact tracing, their ability to test and diagnose individuals that do present with a flu-like illness. So there's a number of preparation events that the state has to really get in place, that we encourage to be in place as they begin to reopen their state, maybe county by county, maybe state at large. But it's going to be a step-by-step, prudent process.
No question about it. We talked last week, and I remember you said we need to have testing for the virus aggressively employed before you can think about reopening. Are we there yet? Are we there yet anywhere?
I think there's certain jurisdictions that we do. I mean, I think people have to look at what the real strategic role of testing is. And at this point, it's to make that rapid early diagnosis, which then you can affirm and then isolate and then do the contacts, then test, figure out of the contacts who's infected, isolate those individuals, then do their contacts. It's really the traditional public health approach for containment. And I think there's a number of jurisdictions that are very close to having that capability. We're going to work with them. CDC is going to work with all the jurisdictions to try to help them correct those gaps, because it is going to be really critical that you have that public health infrastructure as you begin to loosen up these mitigation restrictions.
Whatever you feel about testing in your particular community, I don't think there's anywhere where you're in the position of anybody who wants a test can get a test. And that kind of raises the question, how do we really get a good picture of where this virus is, especially since so many people display no symptoms at all but can still spread it?
Yeah, Savannah, that's a really important question. I do think the systems that we have that monitor respiratory illnesses are very good. But as you pointed out, what's different about this virus is there is a significant number of individuals that actually are infected that don't demonstrate symptoms. We're establishing a series of important surveillance points, sites throughout this country, focusing on first nursing homes, long-term care facilities. They really, in many of the states, have been the incident cases in their community. We're going to be establishing surveillance sites in some of the inner city clinics that we have, and some of the indigenous population clinics, to be really looking to try to identify and understand how much asymptomatic infection is there. I will say, though, from a strategic point of view, you're going to know when you need to start to be concerned that there may be asymptomatic infection when you start to see evidence of symptomatic infection. So when you look in certain communities that have absolutely no symptomatic infection, those are not going to be communities where we're going to have asymptomatic infection. So we are increasing the surveillance system across this nation specifically for COVID, and specifically to try to understand where asymptomatic infection is.
And then finally, in the few seconds we have left, I know people are happy and people are so anxious to return back to normal life. When you hear those glimmers of hope, you might think, okay, maybe we could kind of take our foot off the gas. Do you have a word about the vigilance that's required in these next couple of weeks?
Yeah, thank you for bringing that up, Savannah. It is really important. You know, very gratified how the American public came together and really embraced the mitigation strategies that we had put out, the 30 days to slow the spread of coronavirus. As I said before, sometimes behavior modification is pretty tough when it's to help improve your own health, but the American public really came together when those mitigation strategies were to protect the vulnerable and others. And we need to be very vigilant in that. This new opening up, which has that requirement of early case diagnosis and isolation and contact tracing, is really embedded, as you'll see in the phases, with still maintaining that personal vigilance, that personal mitigation, so that we can continue to limit and protect the vulnerable in this nation. So it's important not to let up at all, but do this in a prudent, gradual way as we go through the different phases and really maintain those mitigation strategies of hand washing, social distancing, wearing a face covering when you're in public, if you're in an area where there's still significant ongoing transmission like we still see in New York, Boston, obviously Baltimore, Washington, different parts of our nation.
All right, CDC Director Dr. Robert Redfield, thank you so much for your time this morning. We appreciate it.